Hi there, mom and dad. Do you have an infant and your baby is crying nonstop? You seem to have done everything. You've rocked baby, fed baby, swaddled baby, but baby still won't stop crying. What is wrong with your baby? Well, mom is stressed, baby is stressed. What to do? It might be colic, or in the Philippine vernacular, we call it kabag. So let's talk about it in this video. But before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you moms and dads so you can raise happy and healthy kids. In today's Ask Me Anything episode, I will answer your top 10 most common questions on colic. Now let's get right to it. The first question I get is, what is colic? So colic is a condition in an infant where baby has uncontrollable crying. But there's nothing wrong with your baby. Your baby is healthy and the doctor has ruled out all the other medical conditions. It usually starts in baby's first weeks of life and baby eventually outgrows it by 3 to 4 months of age. All right, what causes colic? Well, let's take these two babies for example. We have a baby who is gassy, but this baby is chill and doesn't mind having a lot of gas. But we have another baby who is also a bit gassy, but baby's mood is affected and baby is crying nonstop compared to the chill baby. Now this baby might have colic. The exact cause is not fully understood, but it might be due to a combination of things. Your baby might be gassy, might have some gastrointestinal discomfort. It can also be from baby's immature digestive system. It can also be from overstimulation. So baby is stressed, for example, by too much noise at home. Or it can be from parental stress, where baby can also feel stress on his or her mom and dad. All right, number three, how to tell if my baby has colic or if it's something else. Colic is typically diagnosed when baby cries for more than 3 hours in a day, and this happens more than 3 times a week, and this has been going on for more than 3 weeks. That is the usual definition for colic. And like I've mentioned, it happens in a healthy baby. So have your baby evaluated by the pediatrician, and your pediatrician should have ruled out all the other medical conditions that might cause babies crying. It is important that you consult with your pediatrician to rule out other things. Your other medical conditions that might cause baby to be fuzzy and crying can be from gastroesophageal reflux or gastroesophageal reflux disease. You can check the link to my other videos on this. Another condition that the pediatrician would need to rule out is it allergies or a milk protein allergy. And is it a gastrointestinal infection? So if everything else has been ruled out by the pediatrician, then most probably your baby's crying fits is caused by colic. Is colic harmful to my baby's health is the fourth question. Well, colic in itself is not harmful to your baby, but it can be distressing to parents, especially if the baby is crying nonstop. However, what you need to make sure as mom and as dad is that your baby is feeding well. Make sure your baby is gaining enough weight. That is why regular checkups with your pediatrician is important. Alright, is there anything else that I can do to soothe my colicky baby? Well, there are several strategies that you can do to help your baby who is colicky. You can try gently rocking your baby or swaddle your baby in a blanket to make them more comfortable. You can also try using white noise if your baby likes that. You can try offering a pacifier. Or how about you change your feeding technique into something else? Those are my tips for you. Also, consult with your pediatrician. It is better if your baby is evaluated so you and your pediatrician can discuss more about your baby's specific needs. Um, all right. Number 6. Should I change my baby's formula if I suspect is caused by a milk allergy? Well, if you suspect that your baby's crying is caused by a milk allergy, then definitely it is not colic, because colic, everything else, every medical condition has been ruled out. But if you suspect a milk allergy on your baby, it is important that you bring your baby to the pediatrician to be evaluated. If your doctor thinks that your baby might have a milk protein allergy, your baby might be put on a hypoallergenic formula. Or if you're exclusively breastfeeding, your doctor, your pediatrician might recommend some changes in your diet. Can colic be prevented? Is the 7th question. Unfortunately, no. Colic cannot be prevented. Well, my tip for you though is that to make sure that your baby is well fed, your baby has burped properly, your baby is in a calm and soothing environment, and also make sure that your baby is comfortable. All right, number 8. Will my baby outgrow colic? Yes, the good news is, um, even though babies are different, most often than not, babies would outgrow colic by 3 to 4 months of age. That's my good news for you. So it is important that you be patient. Just be patient with your baby at this difficult time, and they will eventually outgrow it as they get older. All right, number 9. Could my baby's colic be a sign of a more serious medical condition? As we've discussed, colic is a benign condition and essentially there's nothing wrong with your baby. But you have to make sure that your pediatrician has ruled out all serious medical conditions first before we label the baby as to be having colic. It is essential that you consult with your pediatrician if you are concerned about your baby. But here's my tip for you. Some signs that you should be worried about, that you need to bring your child to the pediatrician, and it's not any more colic but something serious. If your baby has had decreased feeding, if your baby has been vomiting, or baby has diarrhea, or if your baby has a fever, especially if it's a high grade fever, and your baby is not active, it's important that you seek care immediately. And number 10 question, how can I cope with the stress of having a colicky baby? Yes, coping with a colicky baby can be very challenging. So mom and dad, it is important that you seek support, ask help from your family, ask help from your friends, and communicate openly with your pediatrician so that your pediatrician can refer you to a healthcare provider who might help you on how to deal with your baby's colic. Um, Remember, it's not just colic, and it this condition can also affect mom and dad's mental health. So it is important that you seek help. And of course, never shake your baby if you're frustrated. Put your baby on one side and let your baby cry it out. Just make sure your baby is safe and comfortable. And for you yourself, it is important that you seek help. Remember, colic is only temporary. So, and it will get better with time. Alright, if you like this video, watch my next video where I teach you about other child health problems.